what do you find is some of the common causes of pain for our TMJ people? Like, what are some of the activities and positions that they're doing
Hmm.
that get them in trouble?
Most of it I find is just teeth clenching
Yes.
that people do at night is the most common one. And I think we are also talking a little bit about before we started about some injuries that can occur
Mm.
as a result of some type of athletics and
Yeah, yeah.
um,
Well, let's think contact sport. It's
mhm,
it's January here, so I know the
mhm,
wrestlers are full swing, and every once in a while you maybe get put down to the mat or torqued a little funny, or somebody
mhm,
putting on a cross face and they hit your chin pretty well. Basketball guys might accidentally take an
mhm,
elbow to the face, or same thing with the volleyball players this time of year.
mhm,
But we're even going back to more of like the even more intense contact sport, like the hockey or the football guys that take a
mhm,
hit and they, thank goodness for the mouth guards. That reduces so many more of these
mhm,
injuries we'd see. But
mhm,
even the best of mouth guards don't exactly absorb all that shock that comes
mhm,
from the jaw, and it could be enough to still just
mhm,
put that TMJ out or
mhm.
over irritate the muscles in there, in
Yeah,
which case we're here to help, right?
yeah, yeah, because
Um,
that joint goes in so many directions.
yeah.
It translates forward and
Hmm.
back, and rotationally, and just
And slides,
hmm
right? Slide
yep.
side to side, opens and close. So I mean
Hmm.
that's eight different cardinal movements just
Hmm.
right there. So
So yeah, so it's kind of like the shoulder of the mouth,
that's
a
a good
little
way to
bit.
put it. It sort of is.
That
Yeah, yeah.
makes sense.
I love that you mentioned
Hmm.
the clenching
Hmm.
too. This is another area that we'll just see
Hmm.
people that are dealing with pervasive high
Hmm.
levels of stress. I mean,
Hmm.
you might even notice it if you're having a work day where you're just under a lot of stress and workload. You
Hmm.
might start to catch it's like I'm like doing this where I'm like got my
Hmm.
teeth gritted and everything. It's like, oh, just relax that jaw.
Hmm.
I like chewing gum, but we got to be
Hmm.
careful with chewing gum to
Hmm.
not overdo the joint right there.
Hmm.
People have to be careful about how they're yawning, because if you yawn too hard and you let that
Hmm.
jaw snap, like that's something to
Hmm.
be careful of.
Hmm.
Another common cause of pain,
Hmm.
as we sit here when we jaw off and we talk a
Hmm.
lot about TMJ, but
Hmm.
people that have to talk a lot at work,
Hmm.
sometimes that'll just the talking mechanism is going to
Hmm.
overwork all those jaw muscles potentially too, right?
Hmm.
So just to name a few
Hmm.
pretty common causes of pain,
Hmm.
right?
Hmm.
Right, right.